Hi, you guys. It is day two um, post-op surgery for ACDF, and I had fusion done on C5 and C6, and I've been able to sleep, so that's a good thing. I just have to keep myself propped up, but I spent the night out here on the couch last night, and I got some sleep. And but the biggest thing from all of this is the swallowing. Very, very hard to swallow anything, even liquids. Sometimes the liquids can be worse than solid small pieces of food. And but yeah, it's that sensation that you have in your throat. It feels like there's like a softball in your throat, and anything that you swallow has to like go down and pass around it. It's like there's just this mass in your throat, and that's what it feels like. And that's obviously the inflammation from them going in there and moving everything aside and that. So everything is disturbed and inflamed. But so yeah, it's like having a bad sore throat, but it's down low, low in the throat, like right in the area where like they would do a trach. It's down low like that. So it's not the whole throat, it's just that area where they went in. And so that's been the roughest part. But as far as neck pain, any pain in the back of the neck or headaches or anything like that, nothing like that. Thank God. There's been no pain at all. The only thing that's been hard through this is some dizziness when you're up walking around, which could be the medication, but I had dizziness before going in for this surgery. And yeah, so dizziness, you have to be careful that you don't fall after having ACDF surgery. Naturally, you wouldn't want to hit your head and rack your neck. Um, but the only complaint that I have with it is the swallowing, the difficulty in swallowing. And let me tell you what, you guys, it is difficult to swallow. I mean, and if I lay flat, it's very hard to breathe too. So a little bit of difficulty in breathing and very difficult to swallow, but no pain, in the neck itself or any part of the spine. I do have a really bad upper backache right across my shoulders, up high, and like right between the shoulder blades, and that's because of being strapped down for 2 hours and 45 minutes in the surgery room. That's how long I was in there. Just having the body strapped down in that position for that length of time is what did it. And so that'll gradually go away and get better, but it's noticeable and it's there. And if you have this surgery done, that's what you're gonna go through as well, is upper back pain all across the top part of your back and very difficulty in swallowing. And like I said before, I've had dysphagia for many years, and this surgery causes dysphagia. So for me, it's like twice as bad because I already had a problem there with swallowing. And so, you know, I'm gonna be changing the bandage later today when Sandy gets back from work, and so she can help me because I'm not gonna be able to see much of what I'm doing. So I'll do a video of that of what the incision looks like, and hopefully it still looks good. And yeah, so other than that, you guys, I feel good. I mean, my voice kind of changes a little bit from time to time. It'll sound even different to me, and then it goes back, and then it changes again. So if you have this done, you might also notice that your voice changes a little bit. Some people are unable to talk at all. And then there's the breathing. Sometimes it can be hard to breathe, but the swallowing is the biggest pain. I mean, it's a sensation to where it's awful. It's just awful. And I'll be glad when that part is healed and done and over with because that really is annoying. And I'll be glad when I'm past it. So I lost 11 pounds when they weighed me. So I am losing weight and I'll continue to lose it, but I will get it back once I'm able to eat and eat better than I have now. This morning I've been just having a little bit of coffee and I had some strawberry oatmeal. And so that's all I've had this morning. And then for lunch, I may just have some soup and crackers, and then probably soup and crackers for supper. Because really, there's not much I can eat, you guys, because everything is so hard to swallow that it needs to be either liquid or very, very soft food. So, but later today, I'll do a video taking this bandage off, changing out the dressing, and then recovering it. And and then I'll cover that in a video. So yeah, I mean, outside of that, you guys, it's not bad. I mean, anybody facing this surgery, um, not a big deal. It's not a big deal at all. Just the swallowing you got to get used to. So, and that will only last for so long, and then that'll go back to normal. And but yeah, I mean, I wouldn't be afraid to go through this surgery again. You know, I didn't have no fear going through it the first time, but I wouldn't fear doing it again. And so it's not that bad. And that's why I tell people don't have fear, don't be afraid of things, because people, your mind will have a tendency to make things so much worse than it actually will be. And so, and that's what prevents people from doing things. So don't have any fear, you know, do what you need to do and get it done. And you'll be much better off for it. So anyway, and as you can see, living proof that if you don't have fear of something and you go through it, you can do it. You can do it and come out on the other side. And I will mend. I will get better. Um, hopefully I'm rid of my neck pain. I won't know until I'm done taking the narcotics. These are opioids. So I won't know if I'm rid of my neck pain until I'm done with that. And I also got muscle relaxants, because that pain pills just mask everything. So you really don't know. But I figure within a month, once I'm off the drugs and about a month out, I'll know if uh if he fixed my neck so I don't have any more pain in it. That would be great. I really hope that don't come back. But I will mend, I will get better, and I will be camping, canoeing, fishing, and hiking this year, you guys. So I will be doing it come hell or high water. So I'm determined. So I'm not gonna let anything keep me down, not even this surgery. Nothing's gonna keep me down. I'm gonna be doing what I love to do no matter what. And those videos will be coming later in the year. So in the meantime, I'm going to just be documenting this ACDF surgery for people that may need the advice or want to hear from someone that went through it at my age. Um, it's hard to believe that I'm 51 already. My birthday's tomorrow. 51 years old. So goes to show you can do it even when you're older. So not a big deal. I'll keep you guys posted, and I'll see you guys again in the next one. Thanks for watching. Bye bye.